Hello, my name is Miranda Purcell, and I will be discussing CBT agenda setting today. I'll be discussing several styles of agenda setting and what is included in a typical CBT agenda setting session in therapy. Agenda setting, it's a collaborative, agreed upon agenda that is established at the very beginning of the session. It's very common to use in CBT practice as it helps to keep the session on track and it makes effective use of the time that is available. So I will then go on to discuss two different scenarios that involve agenda setting, and I'll compare and contrast those with each counselor's style and which agenda items they chose to focus more or less on. Next, I shall begin to discuss my personal preferences for agenda setting and which style is most aligned to my counseling approach. Finally, I will talk about several common challenges in agenda setting that counselors may face, as well as solutions for tackling those issues. So let's begin by discussing what is typically included in a cognitive behavioral therapy agenda setting with a client. So, you review the events since the previous session and review the previous session that you had. So the client's week that they've had while they were away, and then review the last session that you had with the client. So this is the very first step to agenda setting. You review the last session because it's very beneficial and you get to recap what was discussed last time and see what the client recalls from the session. If the client is having a problem recalling issues that you previously spoke about and previous techniques that you discussed in your last session, you may suggest a recording device or a notebook for them to have on hand. This way it allows them to take notes and to really understand everything so that they can apply those techniques outside of therapy, which is a key foundation and cornerstone of cognitive behavioral therapy. And briefly reviewing events that have occurred in the client's life, so throughout the past week. This helps to set the foundation for identifying specific items that could go on the agenda that will likely be the main focus of the session. And this part usually takes approximately 5 minutes. It's a great place to launch from, and it helps establish the conversation and start to get into setting the actual agenda. Next, typically, therapists like to go on to assess the client's mood. So this can be done either formally or informally. It can be used with a standardized outcome measure, or it can be informal through the use of questioning. And a big tip for counselors is to write down the scale or questionnaire that you are using. This way you know what scale you used with the client. So when you look back on your notes, you're aware of what outcome measure or scale you might have used. This comes in handy when you're reviewing several sessions. And the purpose of assessing the mood is to see how the client's mood might have shifted or changed since the last session. It also helps to determine whether there may or may not be specific things that may be bothering the client. This way we might be able to add them to the agenda for the day. And time can be spent appropriately and allotted for that to hopefully improve the client's mood. Next, typically, homework is reviewed. So this allows you to see what new thoughts or emotions the homework may have elicited for the client. It typically opens the floor for identifying major topics that need to be added to the agenda. So reviewing homework that you assigned to that client that week definitely helps to move everything along and to establish further agenda items. Next, typically you work on current topics. So this is usually the largest part of agenda setting of the session, sorry. So typically 35 minutes are allotted to discuss current topics after the agenda has been set, and this allows enough time for reflection at the end, and etc. So it is the largest part of the session, working on the current topics, and this may include symptoms that the client is experiencing. It may include some external issues that are going on in the client's life. And oftentimes the counselor has specific CBT techniques that they would like to introduce to the client. So this typically happens within this 35-minute period as well. It's the longest step in the agenda setting because in the agenda in general, so it's usually the amount of time that is allotted the most because it includes all of these miniature steps in it. And it allows the counselor to kind of understand the subjective experiences of the client and just better understand their challenges that they've had throughout the week, as well as the thoughts and emotions that may have come along with that. So it does help them to better understand the client. And then the counselor will typically introduce the CBT techniques that could be used to help combat those emotions or experiences that the client's been having. So perhaps there may be particular CBT techniques that the counselor introduces to the client to help them to handle those emotions and deal with them appropriately. And time will need to be set aside to practice these techniques. So after you introduce the concepts, it's very important to actively engage with the client and make sure they're practicing these strategies and techniques so that they understand the reasoning behind the techniques. And this helps them to better understand how to do it outside of the therapeutic environment. Again, this may go back to using a notebook or having a recording of the session so that they can refer back to this technique when they need to. Because a major goal in CBT is ultimately to help clients take what they learn in therapy to the outside world so that they can effectively apply these techniques when they're experiencing a relapse or a challenging situation. They'll understand what techniques they can implement to hopefully help them, get through those situations. And again, this typically takes about 35 to 40 minutes. This is why it's important to set an agenda and to allot a specific amount of time to speak about each item that the client wants to discuss. And it's best to try to stay on course with the agenda as much as is possible. And you can accept that deviations may occur. If the client has a particular issue that they want to discuss that wasn't on the original agenda that you agreed on, it's best to mention that to the client and ask them if they'd like to rearrange the agenda or if they'd rather discuss the agenda items that were set at the beginning of the session. This not only allows the client to collaborate more on the agenda, but it also reminds them of the topics that they deemed more important at the beginning of the session and helps them to delegate the most time for those issues. So next, homework is usually set, or an assignment. So this usually does also take place during the working on the current topics. This can also happen where homework may be established during that process. But it is usually best, even if homework was already assigned or talked about, to reiterate it, just so that the client understands what's expected of them outside of therapy when they leave the office that day. So typically this follows the discussion of the main agenda topics. There may be certain CBT techniques that the counselor asks the client to practice, again, outside of therapy. Or perhaps the counselor provides the client with rating scales to complete throughout the week. Maybe this relates to levels of anxiety they feel towards a certain activity, where the rating scale could be 1 for extremely low anxiety or 10 for the highest possible anxiety. So the counselor may ask the client to complete this throughout the week. So that could be a homework assignment. And again, this may have already been established, but it's always a great idea to reiterate the homework, just so that the client understands what's expected of them and what they can take with them from the session. And writing this down is a very helpful way to provide them with like a visual cue to elicit their memory. So whether this is an audio clue over the recording or if they write it down, that could be a visual cue as well. And this does typically take at least 10 minutes to go over homework. So it's important to keep that in mind when setting the agenda to make sure that you set enough time aside for the homework portion. And lastly, feedback on the session. And this is one of the most important areas for sure. Some counselors do accept feedback throughout the session. Some of them implement this at the very beginning and continually go through. And other counselors may only do this at the end. Every counselor's style is a little bit different for agenda setting, but it essentially is about asking the client how they feel about the session and about their subjective experiences. So you typically ask for suggestions on how to improve future sessions. It's very important to set enough time aside for this at the end of the session. It helps you to check in with your client. It also shows them that you care about how they are feeling. And the session can conclude on a more positive note. The counselor can accept any criticism as constructive, they certainly should, and use it to remodel the sessions as you move through with the client. So change the approach of future agenda setting if you need to, just so that it works best for the client. So it's best to make sure that everything that went on in session that day, checking in to see if there's any suggestions they had, anything they might have been uncomfortable about, or some feedback they may be able to provide to help with the future sessions. So let us move on into discussing the 2 agenda setting videos. So the very first video was Dr. Todd Grandy. So in this video, Dr. Grandy is conducting a role play of CBT agenda setting with a client. So I think there were several agenda setting items that were present for him. So he discussed assessment of mood. That was one of the things that he assessed. So he conducted an informal mood assessment, and he briefly summarized what the client had discussed and repeated it back to them. So just to make sure his interpretation of what the client said was right. It helps with clarification for sure. A lot of counselors do this throughout therapy, and especially when within the agenda setting, when the client may be going over a previous week or how they're feeling. It's important to understand and be on the same page with the client to be able to empathize and understand how they're feeling. Next was the review of events since previous session, review of last session. So this did happen. Dr. Grandy did start it here, and he used summaries to keep the conversation on track. So he did review with the client last week's session and how that went. And then the client did get into details about how their week went along with their mood. It kind of went into one discussion there. Review of homework was another thing that was also present. This conversation was initiated by the client actually, and it was actually very brief. It didn't go into very much depth. And the homework and assignment for that day was not discussed in depth, but that was near the end of the video. It was evident that Dr. Grandy did have homework for the client. It was unsure exactly what that was, as he did not really describe what homework he had in mind for the client. So this wasn't really agreed upon collaboratively. It was more of the counselor's interpretation of what homework would be best. Feedback on the session did occur. Dr. Grandy had to work with the client just a little bit to get a definitive answer on what the client wanted to focus on for the session. The client did have several major topics that they wanted to discuss, but in terms of time restraints, I think Dr. Grandy helped the client to cut it down a little bit and really narrow down on what topic they wanted to discuss. And current topics. So the client introduced many topics, and they did narrow down which to focus on. There were no missing agenda items per se. There were some agenda items that were discussed a little bit more in depth than others, but everything was touched on. An informal assessment measure was used for the mood as opposed to a formal assessment measure. Otherwise, everything was really touched on. And I found Dr. Grandy did a lot of summarizing. He did gently interrupt the client approximately once or twice when she started going over her previous week, and then when she was trying to narrow down which topic she wanted to discuss during therapy, he gently kind of interrupted her when she was slightly rambling and pushed her to choose the most important topic to add to the agenda that day. And when the client had difficulty narrowing down what they wanted to discuss, he asked probing questions to help her understand what the major concerns were. And I thought this was very important. I thought this was very helpful when the client might not know or might be a little confused on what they want to focus on. I thought that was a very good thing he did. I think that was a very strong method for him, was to ask those probing questions in a delicate way, just to help the client and push her along into choosing what topic was best. And I really liked how once the agenda was established, Dr. Grandy laid out the agenda prior to getting started, and he looked for the client's agreement, just making sure that they were okay with everything and that the most important issues were being discussed. Something I was not so keen on about Dr. Grandy's agenda setting style was that he was not very praising towards the client for the things that she did effectively, such as completing her homework. I do believe it's very important to let clients know that they are doing a good job, or showing that you are proud of them in some way. And this can facilitate more homework completion in the future. When you show that you care that they've completed it, it helps them receive validation for what they've been working hard on. Otherwise, the client may feel as though they are completing the homework without a real reason. And even if the client doesn't fully complete the homework, I think it's still beneficial to spend some time on understanding why they didn't complete it, what they found challenging. This might help to establish more things on the agenda that day. And overall, it shows that the counselor is invested in the client's therapeutic journey, and it reinforces how the homework is such an important part of CBT. For the second video, the qualia counseling, there were several agenda items present. Mood assessment. So in the previous session, it was mentioned that they completed a formal assessment in the previous session. So the counselor went on to conduct an informal mood assessment for this session. There was review of homework. So the client discussed what they really liked about the homework and how it was effective for them and how they actually really liked receiving homework. So the client discussed that in detail. And the counselor did encourage feedback from the client throughout the session. And he made sure to check in after adding or taking away something from the agenda, looking for client approval, which I thought was very, very important. There was a review of the previous session, discussing what was done and how well the homework may have been applied. And review of the events since the previous session. So the client contributed their thoughts and emotions that have been plaguing them throughout the week. And this helped to establish the agenda. There weren't any missing agenda items from the second video, and neither counselor was missing agenda items, but the second counselor certainly went on to discuss more in depth each agenda item than did Dr. Grandy. And I liked how the acting counselor, the second counselor, used a whiteboard to lay out the agenda items for the session using visual cues It allows a reference point to turn to throughout the session, and it helps keep everything on track when you can see it right there, and so the client knows what you're discussing and you're aware, and it keeps everybody in line and knowing, okay, this is what we're talking about today. And the counselor did use summarizing in the second video, but they didn't interrupt the client at any points during the conversation. I did think perhaps it was because they were different clients. Perhaps the counselor did not need to interrupt the second client, but perhaps in the first video, Dr. Grandy did need to interrupt the client, as there was slightly more rambling and more words expressed by the client in the first video. I really enjoyed how the counselor is showing their energy and is more rewarding with their words, giving praise for clients for things that they did successfully, perhaps implementing the homework effectively or making big steps in therapy. I found the second counselor was very energetic and very rewarding towards the client. And I thought this was a very important aspect for CBT. Because I think clients certainly deserve recognition when they're making important steps and are using the CBT techniques outside of therapy, just as the counselor asks. I really liked how he is introducing what kind of CBT techniques he would like to work on as well with the client, and he asked if it would be okay to add that into the agenda, not just assuming, whereas Dr. Grandy he did ask for clarification at the end, but he didn't specifically ask, oh, is it okay if we include this CBT technique today? So I did think it was very interesting how the second counselor chose to go into more detail with that and about CBT techniques in particular, explaining the importance of why he wanted to implement the technique and looking for client approval. Whereas Dr. Grandy did not really do this. He didn't seek permission, and he did not go over the importance or benefits that could come from the techniques, which I thought he could have went into a little more detail about before ending the agenda setting. Overall, I would say I prefer the second video style, the qualia counseling, because I liked the counselor's flow of the session and how they used a whiteboard to visually create the agenda. With the client. I also really like that he asked for feedback from the previous session very early on in the conversation. This allowed the client to ruminate over the previous session and provide more honest feedback to the counselor. And the counselor encouraged the client to provide feedback at any point throughout the session, which I think is important. Because sometimes if you wait until the very end of the session, the client may lose that thought. Or unless they are prompted to write those thoughts or feelings or suggestions down as they occur, sometimes they may be lost at the end of the agenda setting when perhaps they don't think of it anymore and it might be gone. Additionally, I do like how the counselor used a formal assessment measure to assess the mood in the previous session, and chose to go with a more informal approach in the second. It shows a mixture of methods, which I think is important. It keeps things interesting for the client so that the assessment provides honest results each time of the client's mood, so that they don't get too used to a measure so that it would be redundant. So I prefer the second agenda setting technique because it felt more collaborative. The counselor sought client feedback throughout the creation of the agenda and used a visual representation, a whiteboard, to set the agenda. The whiteboard allows both the client and the therapist to be on the same page and on the same track. I think this is really important. It's such a small detail, but it can make such a difference in terms of understanding the layout of the agenda and making things flow so much better. The second counselor definitely demonstrated a high affiliation relational counseling style, which is characterized by establishing a warm and welcoming environment for the client and being more friendly and outgoing, as opposed to Dr. Grandy from the first video, where he had more of a neutral, distant relational counseling style, where he took on more of a psychoeducative role and wasn't quite as warm as friendly as the second counselor. I would say I certainly align more with the high affiliation relational counseling style. I think that collaborating continuously with your client will elicit more engagement and more discussion when you're seeking feedback and making the client feel safe and secure. It's very important to me to make that environment. I want to create a warm and friendly therapeutic environment for my clients. And I will now discuss 3 common challenges that counselors often face during agenda setting discussions. So step 1 in agenda setting is reviewing the client's previous week. It's meant to be brief, therefore the counselor may have to, on occasion, gently interrupt the client if they go into extensive detail about their week and the problems they have faced, such as Dr. Grandy had kind of encountered in the first video. The interruption should be done cautiously, though, because some clients may take personal offense if you interrupt them too much. It's recommended to use actually positive reinforcement techniques. The client mention or complain about you interrupting them. It may be beneficial to use positive reinforcement techniques. It's best to apologize and negotiate on a set amount of time to set aside for the client to speak about any major events that might be going on in their lives. So perhaps saying, okay, why don't you let me know what's been going on for about 10 minutes and then we will touch base. And then at that point, after the 10 minutes, you could summarize and repeat back what you have heard just to confirm that and check for understanding and clarification to make sure you perceive things in the same way that the client did. It is important to be on the same page, especially for CBT to work properly. The second challenge, in other instances, a client may fail to contribute to the agenda setting process. This may be because they don't have specific goals in mind. Therapists can begin stimulating a discussion for goal setting by asking more open-ended questions, such as, how would you like to feel next week when you come for your session? And what can we do today to help you feel that way? That might be a good starting point. So then the client starts thinking, oh, well, I'd like to feel better about XYZ. And then you can start from there and start to form those goals and those agenda items. By asking probing questions about what they'd like to discuss, you can help tease out specific goals. Another method that could be used to facilitate further conversation could be conversation cards with the client. So having those nearby and just say, oh, would you like to look at these conversation cards to see if there's anything that sparks interest? You might have different things such as relationship issues or upcoming events in your personal life. There could be several cards with several things written and see if there's anything that speaks to them. And that allows them to bring anything to our attention that they might want to discuss that they didn't think of initially. And they may stimulate thoughts for the client, and these thoughts can be translated into goals for the session. Thirdly, challenges may be experienced when conducting the mood assessment portion of the agenda setting process. Clients may be resistant or find it challenging to complete the assessment forms. If they appear to be annoyed with the task at hand, it's important to identify any automatic thoughts that may be associated with that task and make sure to respond empathetically to help them evaluate why they have those thoughts and feelings towards completing the questionnaire. If they continually refuse, it may be best to switch it up a little bit to go to an informal measure rather than a formal standardized measure. For example, verbally doing a rating scale. What is your mood today from 0 to 10 this week? With 0 being very sad, 10 being very happy. Occasionally, it might be beneficial to pivot in your approach to suit the needs of the client, especially if the same questionnaire is administered weekly. Again, switching it up a little bit might be the best thing to do. To reiterate, I certainly align myself more with the second counselor's approach towards agenda setting. Using visual cues to improve client engagement is very important, and having a collaborative and warm approach. I want to play a more interactive role in the agenda setting process and keep the energy flowing, just as the second counselor beautifully demonstrated. Thank you very much. I appreciate it. Have a great day. Bye.